My name is Dr. Adaorah Enyi, and the co-founder and chief operating officer at Oncobody Technologies Limited. We're a digital health innovation company based in Lagos, Nigeria, where we are empowering confident cancer care decisions for patients, clinicians, and leading healthcare companies. I also am a director of research and innovation at Pearl Oncology Specialist Hospital. We're a women's-based cancer center, comprehensive cancer center in Lekki, Lagos, Nigeria. And what we do basically is that we provide comprehensive cancer care services for women, from chemotherapy, targeted therapy to surgeries, supportive care, palliative care, and various specialized clinics that we run. We've been able to make impact across various countries, about 8 countries across the world, but most of our impact has been within Nigeria. I'm happy to be here on today's interview with Just for Women Africa.
What inspired you to pursue a career in medicine and healthcare innovation, particularly in oncology?
Okay, so my story or my interest in oncology started in 40 of medical school. So my 40 of medical school, I lost a friend to hepatocellular carcinoma, and it was just barely 3 months following his diagnosis. And I remember feeling helpless. I remember there was really not much I can do. I was just a medical student. I was just barely finding my feet in medical school. As I went along in my journey through medical school, I was opportune for every clinical rotation. So in my 4th year, I rotated through gastroenterology unit where I saw high volumes of cancer patients. In my 5th year, the same thing too. In my final year, same thing. I was always rotating through all of the specialties in medicine, be it internal medicine, be it surgery, be it obstetrics and gynae, and or even pediatrics. I would always be placed in the oncology department of those various specialties. And so I got to interact with a lot of patients. And one thing was clear, a lot of patients were presenting late. Many patients, by the time they are presented, they are dying, right? And so that sort of struck a chord in me and piqued my interest really for oncology. And then as I continued in my career, I started volunteering, working as a community physician through the not-profit called Shebekli Cancer Care. And one thing was very evident was as we went into the communities, interacting with a lot of people, there was this limited awareness. So many people didn't know cancer existed. For those that knew cancer, they saw it as a death sentence. And so they were not just even interested in doing any of the screening tests. They didn't just want to know. There was this God forbid mentality that was associated with it. So really, there was that paucity of information across cancer care for a lot of patients and a lot of people, particularly even women. There was a high mortality rate. And then we understand that because we were in a country like Nigeria, where even though there are over 200 million of us, there are less than 100 clinical oncologists, right? And so with that limited number, we knew that we didn't have enough specialists to meet up with the demand, right? So every year, Nigeria is seeing over 125,000 new cancer cases. And we just had less than 100 clinical oncologists. So we didn't have enough to meet up with the current demand. But we could leverage something like technology to actually increase access. We could leverage technology to redistribute our limited resources from those areas to areas that didn't have. For additional context, in Nigeria, even though we say yes, there are less than 100 clinical oncologists, it's sadder to note that more than 18 states in Nigeria don't even have a clinical oncologist at all. So that means about 18 states where people where cancer patients will come from don't even have the specialist available in those states. And so all of this informed my decision on building, a solution. And so I worked tirelessly with my team for more than 6 years now to build a companion app that responds to the needs of cancer patients. And we really want to do 3 things. We want to help patients present early. We want to remove that fear from the cancer equation, that stigma that is associated with cancer. And we want to provide patients with the right resources, right, so that they can live to their fullest potential. We want every cancer patient, irrespective of, whatever the diagnosis is or whatever stage we meet them at, we want to be able to extend, their life span with us. We want to be able to improve their outcomes with us. And so that's really what informed my decision into oncology and into leveraging technology. And of course, till date, we've been able to serve more than 4,000 patients. And I think what is most inspiring is not the numbers we've even been able to reach, but the stories behind some of them. And I'll give an example. During the COVID-19, and that was 2020, we had a very unique case. This lady was just in her early 20s, I think about 22 or 23 years old. She was from Sierra Leone, right? We had never met her outside of the app. So she had reached out to us via the app. She had some cervical symptoms and she had gone to so many places, but everyone had been, associating it with different things, promiscuity and, so many other things. And so for her was really coming to a place that we could understand our problem and help navigate her. And we were able to do just that. We understood our problem. We walked her through what was required and we connected her to diagnostic centers in Sierra Leone where she was able to get the right tests, get the right treatment. And even though she was diagnosed with stage 0 cervical cancer, she was treated for it and 3 months down the line, she was cancer free. And so many of these inspiring stories are some of the few stories we get on Oncopadi when we're able to save lives, when we're able to make a difference in the community despite our limited resources.
How come doctors are not able to detect some cancers in the early stages?
So I think the case is not really that we're unable to detect it. The case is that most patients actually do present late. And I'll give an instance. There was a woman that came with a breast lump, right? And this breast lump was already fugating, it was smelling, it was ulcerous. There were so many lesions that associated with it. Now, this woman, when she came to see us, right, and we had to give care, unfortunately, we had to offer palliative care, and she did pass on after about a year or so of being on treatment. But at the point where she was presenting, it was presenting at a stage 3, which was pretty late, right? That was already advanced breast cancer. But this woman, what was so unique about her story was that before it became the way before the symptom presented that way that she finally came to us, right? It started off as a small little boil in her breast, which was less than 1 centimeter when she felt. So it was just like a small pebble, like a small stone in her breast. Now, it took her almost a year and a half before she actually met us. So meaning that for more than 18 months, she had been going to various places, which was her story. So initially when she saw it, she said somebody had prescribed some antibiotics for her. She took antibiotics. It seemed like it worked. Then it started increasing again. Then she tried out all other orthodox kind of medicine. Then she went to the prayer ground. She went to camp. She was in camp for months, doing prayer, fasting, ministration, and all of that. Everything she did, but none of it was the actual solution she should have been taking in line with, her diagnosis. So she had presented when it was still a 1 centimeter lump, right? We could have managed it, right? That's a stage 0, stage 1 breast cancer that could have been taken care of with a simple surgery called a lumpectomy and would have, resolved it. But at the time when she was presenting to us, she was presenting to us at about 18 months post her initial symptom. So we were making that cancer diagnosis at 18 months post the initial symptom that it presented at. And so at that point, it's already too late. The cancer, even there was some form of metastasis, but she was already having trouble walking. So there was already metastasis to the bone, to the femoral bones, right? And so she had problems living. And the truth is, this is really the sad situation across a lot of patients that we meet. Many of them are misinformed, right? They are speaking to the wrong people, right? They are speaking to if they're not speaking to the wrong people, they are speaking to the wrong doctors. I mean, for those that are not challenged by finances for their diagnostic workup of cancer, then there's that stigma around cancer. There's that cultural and religious stigma of it cannot be cancer. God forbid, nobody in my family has it. And you go around treating every other thing but that diagnosis that you're trying to run away from. So my message really to everyone, and I think really what is common is we want to help patients present early. And how can we help patients present early? You can only present early for something that you have the right information about. And so you will notice that there's that paucity of information, right? And that's really what is evident with a lot of patients. So just as I said, it's not really about misdiagnosis. There is some degree of misdiagnosis that happens, right? But a greater majority of studies and even clinical experience has taught us that a lot of patients present late. And there are so many reasons why patients present late. But the three major reasons are centered around, misinformation. So they have the wrong information they go around. There's financial issues associated with the cancer diagnosis, it being financially toxic. And thirdly, there's just that stigma and fear associated with cancer that doesn't allow patients to present early.
What are the main reasons for the rising number of cancer cases in Nigeria and across Africa?
Okay, so I would say in terms of causes, a lot of cancers have no known cause. Very few cancers have causes. So for instance, like cervical cancer, we know the cause, which is the human papilloma virus, right? And it's sad because cervical cancer is the second type of cancer with the highest mortality in Nigeria, following breast cancer, right? So there's no known there's a known cause for cervical cancer, which is human papilloma virus. But there are also other oncogenic factors that actually predispose one to actually contracting the human papilloma virus. Then in the case of breast cancer and like many other cancers, there's no known cause. However, there are associated risk factors, right? So things like, of course, diet plays a role. Our sedentary lifestyle plays a role. It has also been known that breast cancer is commoner in Black women compared to the Caucasians. So that's a known fact. There's also the breast density that also plays a role in the risk factor. So women with, more breast density, right, or denser breast mass have a higher risk of, breast conditions, and one of those breast conditions being breast cancer. Then there are other environment or other factors that actually or other risk factors that are actually useful. So things like the use of hormone replacement therapy or oral contraceptives, HIV being one, poverty, nulliparity, so your parity status. So a woman that has not been exposed to progesterone. So one thing you must know is that with breast cancer, and just like with many other cancers, breast cancer is a cancer of hormones, right? And so in a woman who has not been exposed to or has been exposed to estrogen all her life thanks to menstruation, but has not had the chance to be protected by pregnancy or progesterone being the hormone indicated, then they have a higher risk. But it's sad to note that despite all of these risk factors that we've been able to identify over the years, more than 60 to 70% of cases that we see are actually sporadic, which means that most of these cases, they don't have any of these risk factors. So when we do their breast risk assessment and we look at all of these risk factors that are highlighted, they don't have any of them. So they are not older women. You see women younger than 30 years of age. These women that are younger than 30 years of age, they're actually married. They actually have kids. So it's not a thing of pregnancy. When you look at their breast density is not high. The only single risk factor that you can see in them is that they are women. They are women that have breasts and they are blacks. That's the only thing. All of the other risk factors like smoking, diet problems, use of oral contraceptive, being on hormone replacement therapy, having comorbidities like HIV, poverty, it doesn't check on that box. And so it begs the question is, are there other underlying factors that are probably not known to us? And it's very, very possible, right? There are studies to show that there are certain, metabolic syndromes that are now evident in Black people, particularly Black women, that may be predisposing. But I don't think those studies have been concluded yet. But I know that, yes, for one is if you look at it historically, why does it seem like cancer is more common now than it was in the past? Yes, diet does have a role to play. I mean, for one is in the past, we knew that our foods were from farm to table. But now we have our foods being, packed in funny packages. They are over processed. You have meats that's been on the shelf for months, right? Having a 1 year expiry date. So there are so many things that have changed, and then also our lifestyle. Our lifestyle now is a lot more sedentary. So a lot of us are getting very obese quickly, and that is also contributing. So I think yes, to just wrap it up, it will be yes, diet and lifestyle has a role to play. Although we don't have conclusive evidence on the extent of damage it plays, but we do know for sure that yes, it does have a role to play. In probably why we are seeing a higher incidence of cancer generally.
Tell us about the Onopadi app and what it does.
So currently, the app is available. It's a web app that's currently available, and there are 5 things they are able to do when they get on the app. So the first thing is around education. We try to educate them on the app. So we have a rich library of resources where we educate patients from sensitive topics surrounding their diagnosis, what is breast cancer, diet, fertility, right? And a few other sensitive, the role of caregivers, the role of your family members in supporting you on your journey, and a few other issues that patients have spoken about to us in the past. The second thing they are able to do is our teleconsultation, which are virtual consultations on the app. And so virtually they are able to speak with a medical officer, they are able to speak with an oncology nurse, they are able to speak with an oncologist, depending on their choice. And so during these consultations, there are counseling sessions, we go through their diagnosis for a lot of people that need second opinion. And so maybe you've gotten a cancer diagnosis somewhere, or you have a suspicious symptom and you're not clear on what it is, you're able to book a consultation on the app. The third thing patients are able to do is access to diagnostic tests. So one other problem that patients face is that even though the doctor has said it most likely may be this, go and run ABCD tests, many of them don't know where to go. For those that know where to go, they are limited by price. And so on Oncopadi, we are giving patients the power to do 2 things, right? So we're giving patients the power to know all the available diagnostic centers that are closest to them. And we're giving them the power to be able to make informed decisions based on pricing. So even if you say, oh, you want to go to this diagnostic center in Lekki, but this diagnostic center in Lekki may be too pricey for your pocket, there are other options available that would still run that same test and of quality. And we've partnered with about 8 diagnostic centers across Lagos State that actually helps patients in making that informed decision. The fourth thing that we have on the app is our Onco Screen tool. So that screening tool also helps patients to say, so if I have this symptom, if I have that symptom, and I don't want to necessarily speak to a doctor, right? I don't want to book a consultation. I just want resources that tells me this and this. So it's a chat bot system that enables you to put in certain information about yourself, and it provides you with recommended clinical advice on what to do, right? And the last feature that we have is our support groups. So we have a rich community of support groups on the app that actually educates patients on various things. And the beauty about these communities is that it is anchored and served by the patients and patient navigators, right? So patients even find it as a community to do other amazing things. Like for one is there's a woman on one of our communities. She's a breast cancer survivor and she sells homemade soap that she makes within the community, and a lot of women purchase from her. But I'm sure, and one thing she says very well is that the community has given her purpose, right? Because if she was to go about it the regular way like you and I would, it's a bit more difficult. But finding other women that can relate to her story gives her strength, gives her hope, and helps to carry the message out better. We also have other support apps based on programs that we've launched in the past. So for one is we have what we call the ProScare app. And this is strictly for certain types of breast cancer patients that are undergoing treatment. So this is for patients that are undergoing treatment. So patients that are on radiotherapy treatment or chemotherapy treatment or even surgery, they come down with what we know as treatment-related side effects. all types of therapy come down with that. And so what happens is that after you receive treatment, you begin to experience side effects as a result of that treatment that you've gotten. But because you're at home, you're disconnected from your team, right? Your care team, the team that was administering treatment to you. So on this app, you're able to log those side effects or report those side effects that you are experiencing, get connected to physicians that would actually help you to manage those side effects, report remotely, and give you some form of intervention and let you know when those side effects are too severe for you to manage at home, that you actually need to present to the hospital. Now, we found this as very useful because a lot of patients, as much as a lot of patients experience challenges um, during their treatments, many of them actually die as a result of these side effects. We have incidences of patients actually dying as a result of these side effects. And so this tool has been useful in curbing that underreporting of side effects, curbing that treatment interruption. So some patients, and I'll give an example, a patient on a head and neck patient, you're on radiotherapy, right? Head and neck cancer patient, you're on radiotherapy. You start having difficulty swallowing, right? Because you're experiencing difficulty swallowing, you can't eat, you can't drink, right? But of course, there's no avenue for you to actually report this to your doctor, because all you do is you come for your therapy and you go back. So what that happens is that because the difficulty swallowing becomes too much for them, many of them will stop treatment completely, right? Rather than complete their treatment. So you have a lot of treatment. But with the ProScare app, we're able to navigate you on this problem or this issue the patient is facing and help them stay on treatment till they are remission, until they are they go into remission and they are cancer free. And so that's what the ProScare app does.
What are some common early warning signs of cancer people should be aware of?
Okay, so I think generally for all types of cancers, one of the commonest symptom that you look out for is unexplained weight loss, right? So if you're losing weight and you cannot explain, you're not exercising, you're not dieting, and you're just losing weight, right? That's a cause for alarm. Don't say, thank God, though, I'm losing weight, or the God of calorie burner is working. No, the God of calorie burner is not working, right? If you're losing weight and you can't explain why you're losing weight, that's a very telltale sign. The more specific signs and symptoms that you should be worried about, especially as you go across various cancer types, especially as you go across various cancer types would be, so for instance, in breast cancer, right? If you see a lump in your breast or if you feel something abnormal in your breast, right? Please complain. And it's good to note that breast cancer does not only affect women, breast cancer also affects men. In fact, 1 in 100 cases of breast cancer that we see are the men. So the men are also not free from it. So it's important that you check your breast regularly so that when you feel something abnormal, you can, complain about it. So if you feel a lump, you feel a swelling. And what is worse about breast cancer lumps is that they are painless. So they can go on months just increasing in size and you will never notice until you actually feel your breast and check and know that there's something growing there. There's a mass growing there. Other symptoms will be unexplained fatigue. So if you're the type that you're feeling tired, tiredness unnecessarily, you can't explain where the tiredness is coming from. You're always feeling tired. It's a warning sign that you need to check, right? And tiredness fatigue will most likely be as a result of low blood levels, which will actually be as a result of cancer actually eating those blood levels or the tumor being fed by those blood levels. More specific symptoms. So for instance, in the case of prostate cancer, when you're looking at your urinary symptoms, so your lower urinary symptoms, so if you're having troubles urinating, painful urination, difficulty urinating, frequent urination that doesn't complete, so your urine, you start urinating every few minutes, but you're not able to complete that voiding. So we'll say it's an experience of incomplete voiding, right? Or there may even be blood in your urine. That's also a cause for alarm. For women, if you're having painful sexual intercourse, and in the case of cervical cancer, which is more in women who are sexually active, so pain during sexual intercourse, right? Or you're seeing blood, and when you shouldn't be bleeding, when you're not on your period, that's a cause for alarm. And there are so many other depending on the various type of cancer.